Hello, my name is Harriet Harris, known as Bess Harris on Facebook. I'm a nurse. I've been one for almost 39 years. And I don't do these types of web presentations very often at all. This is probably the second time I've ever done this. But I'm very passionate about what's going on in our world today. I want to talk to you a little bit about what I know as a nurse about personal protection. When I began nursing in 1981, there were no gloves that nurses wore to give routine patient care to our patients. That's right, we actually bathed our patients, fed our patients, made beds, even emptied bedpans without wearing gloves. If we were handling a bedpan, we may drape some paper towels over the side of it and take it into the bathroom. And there was a bidet-like lever that would come down instead of going up. Like a bidet would actually come down and rinse the bedpan out and allowing us to clean it. And then we could wipe it down with some more paper towels and give it back to the patient. But there were no gloves. Nurses were taught to wash our hands very frequently and very thoroughly. And this is the kind of hand washing that we are being told that we need to do today for at least 20 seconds. Soaping the hands thoroughly, including the thumbs and wrists, and letting the soap run off under running water after about 20 seconds, and then using a paper towel, a clean paper towel, to turn the faucet off once we've washed our hands. We were taught this back then. And surprisingly enough, back then, the rate of infections for patients in hospitals and nurses as well was a lot less than it is today with the use of gloves. Of course, by the later on in the 1980s is when the AIDS virus was discovered, and it was discovered that that could be transmitted through body fluids. So that's when gloves became all the rage in the hospital and in all the healthcare settings, because we did have to protect ourselves from the body fluids, a potential infection from body fluids. And so what was introduced was called universal precautions, which is to wear gloves when handling anyone's body fluid, whether you knew they had HIV or not. We use gloves. But again, we were still taught to wash our hands very thoroughly before putting on gloves and also after taking off gloves. And again, the rate of infection did not increase substantially until later on, years later, after people started wearing more and more gloves. And think about the use of gloves. Now, people put them on a lot of times. You see, at the airport, for instance, you see the people who handle your boarding pass and ID. They're wearing gloves. They keep that same pair of gloves on as all hundreds of people come through their line to get their boarding pass and their ID check. They're touching everybody's dirty boarding pass and ID. If it's not dirty, when you hand it to them, it's dirty after they hand it back to you, because they've handled 1,000 people's ID and boarding pass before you with that same pair of gloves on. You might see them when they take their break, take those gloves off and maybe go wash their hands at that point. But at that point, they've passed thousands of bacteria to everyone's ID and boarding pass that they have touched. Now, if you take your boarding pass and ID and then you put it back in your pocket, or you put it back in your purse, and then you go through the line to get your get your items X-rayed, you handle you've handled that ID and boarding pass with your hands, first of all. So you've picked up the bacteria that they put on there for you. And then when you grab the bin, you put the bacteria on that and put your shoes and purse and all that stuff in the bin, and then it goes through the X-ray machine. You walk with your bare feet on the floor, tracking up other bacteria as well. And then you get your items and you go on about your merry way. How many of us stop at that point and sanitize our hands after we've handled those items that so many other people have touched at that point? I don't see many people doing that. But I try to make it a practice to always sanitize my hands at that point in time so that I don't carry that bacteria any further than I need to. And hand sanitizer back then when I first started nursing was unheard of. We never even had anything like that. But that was designed to be just a stopgap measure that you would take before you could get to some soap and water. It was just a measure to just quickly clean your hands until you could actually wash your hands. But we see people using hand sanitizer like that's the cure-all for all the bacteria and everything that's on their hands, and they go about their merry way and after using that hand sanitizer and never wash their hands. Think about bacteria or pathogens, as the CDC would call them, which is microorganisms capable of causing disease and death, like the coronavirus. Think about those things like red paint, if you would. If you got red paint on your feet and hands while you were out, when you got home, you would more than likely try to clean that paint off the bottom of your feet before you ever came in the house. You would certainly try to get it off your hands before you ever came inside your house. But if you didn't, if you wore those shoes right on into the house, you tracked that red paint right on into your whole house. Maybe you went and sat on the couch. Some people would even sit on the couch with their feet up on the couch. With their shoes on. So now that red paint's on the couch. If you go to the bedroom, you've tracked it down the hallway and into the bedroom. And maybe you left the shoes in the closet in the bedroom at that point, but the red paint is still on the floor. So now your bare feet or your socks is tracking around in that red paint. And at that point, you may go back to the living room and jump on the couch because now you just got your socks on, so you feel like they're clean enough to sit on the couch. Or if you haven't washed your hands, you go to the refrigerator, touch the refrigerator door. Now the red paint's on the refrigerator door. The red paint's on the milk or whatever you grabbed out of the refrigerator to get a quick snack. If you have not washed your hands before you did that. So that is how I think this virus is being transported to everyone and anyone who's susceptible to it. The CDC guidelines and the World Health Organization are saying that it can live on surfaces anywhere from several hours to some days, actually. So think about all the surfaces that people have touched, and then others came along behind them and touched those surfaces as well. Like when we go to a restaurant, for instance, the waitress hands us a menu that dozens of other people have already touched that they may not have sanitized when the restaurant closed down for the night before. But even if it did, how many times do they sanitize it during the day while people are handling it when they walk in? And many times people walk in right off the street with their dirty hands and handle the menu. And then if the waitress hands you that same menu, if you don't stop and sanitize your hands or wash your hands, you picked up the bacteria that was on that menu. If you use the ketchup or the mustard that's on the table with your bare hands, that too may be loaded with bacteria that you have now introduced to your plate. If you use your hands to eat your food while you're in the public, after you handle that mustard and ketchup on the table, you pick that hamburger up and eat it with your hands, there's that bacteria then going into your system. So I would like for us to really think about how we are interacting in our environment and what things we really should be doing to protect ourselves. And know that gloves, a mask, and all that's fine. But if you don't take those items off, particularly gloves, if you don't take them off after you have touched a contaminated surface, you're just spreading the bacteria on to the next person. And it's being transmitted to 10 or 15, 20 people who might come along and touch the same surfaces that you've touched. I see people wearing gloves when they go in buildings a lot of times, but they handle that door handle with those gloves on. Then they grab their cell phone and they put it to the side of their face. And cell phones are another thing they're extremely dirty because people put them anywhere and everywhere. You see cell phones sitting on the counters in public bathrooms. You see cell phones, all over the place, where people have set them on the floor and on so many different places. And I think that's a major issue with how this coronavirus is being transmitted as well, with the use of dirty cell phones. People sometimes never disinfect them and just, carry them all over the house, eat with them, touch them to the side of their face constantly. So, as I said, I don't do these kinds of podcasts or videos very often, but I am writing a book, and it's entitled "Being Smart About Your Health." So this is from the section that I'm including in the book, but I did want to share this information because I do feel terrible about how this thing is spreading. And as a nurse, and having been one for so many years, I'm retired now, so I'm not going to be getting back in that rat race and working in a hospital. But I'll be 68 on my next birthday in June. But anyway, I did want to bring that to your attention, though, and I hope you will share this. Again, my name is Harriet Bess. On Facebook, it's Bess Harris. Share this with your friends or family, and look forward to my book coming out, which is called Being Smart About Your Health. Take care. Bye-bye.